Among the most fundamental human needs are food, shelter, and access to health care. And there's one more requirement: people who care about what other people need. That's the story of CHRISTUS Health. CHRISTUS is a non-profit Catholic healthcare system that spans the Americas, one of the 10 largest Catholic systems in North America. CHRISTUS operates more than 60 hospitals and facilities in the United States, Mexico, Colombia, and Chile. We're a diverse system with hospitals large and small in urban and rural areas, outpatient services and clinics, physician groups, insurance plans, surgery centers, and long-term care services. CHRISTUS Health is built on a mission and on heritage. The mission? To extend the healing ministry of Jesus Christ. The heritage? A tradition of caring that goes back to the days of the American frontier. In the 1860s, the first Sisters of Charity of the Incarnate Word were called from Lyon, France, to provide health care to the burgeoning city of Galveston, Texas. Over time, the congregation would become identified as the Sisters of Charity of the Incarnate Word of Houston. Soon after, the Sisters of Charity of the Incarnate Word of San Antonio were established, creating Santa Rosa Hospital. More sisters would follow, and 3 sisters would answer the call to serve the needs of San Antonio and establish the Congregation of the Sisters of Charity of the Incarnate Word of San Antonio. For nearly a century and a half, the congregations of Houston and San Antonio and their partners continued to build hospitals and established health systems across the South and Southwest United States. In 1999, the 2 health systems were united in a single system under the name CHRISTUS Health. And in 2016, CHRISTUS Health added a 3rd sponsoring congregation, the Sisters of the Holy Family of Nazareth. The Sisters of the Holy Family of Nazareth traveled from Rome to Chicago in 1885, where they cared for the orphaned, sick, and poor, and opened their first hospital to serve all those in need of care, especially immigrants new to the city. In the same way, we partner with our founding and sponsoring congregations to support the important work they do around the world, touching those in need, particularly in the U.S. and Latin America. Like them, we believe in service to the most vulnerable in society. We believe in reflecting the diversity of the community. And we believe in sustainable practices that care for the earth. With the help and support of our congregations, CHRISTUS focuses on 4 relevant and timely strategies: clinical integration and population health management, operational efficiency and effectiveness, growth in the U.S., and growth in Latin America. Let's take a look at each of these. Clinical integration means developing innovative ways of providing care that meets the needs of busy populations, reducing expensive hospital stays. And population health focuses on working with local communities to tackle chronic health problems before we have to treat the victims of them. We care for the most vulnerable, and we make sure more people have access to the care they need. Operational efficiency and effectiveness. Being efficient and effective lets us invest, expand, and serve more people in need. We work to be the model of providing personal and compassionate care to our patients. And we make sure all those who share in our ministry are engaged, motivated, and fulfilled in their work, because we know that satisfied and engaged health workers provide the best care. Growth in the United States. Today, CHRISTUS operates in 4 U.S. states: Texas, New Mexico, Arkansas, and Louisiana. We build in our strongest markets and increase our relevance within them. We grow to meet community needs inside our facilities and outside. That's why CHRISTUS provides over $300 million in community benefit each fiscal year. Expanding our services in Latin America. From our earliest days, Latin America has been part of the CHRISTUS mission. In Mexico, CHRISTUS Muguerza has 9 state-of-the-art hospitals and dozens of other facilities and services in 6 states. In Santiago, Chile, CHRISTUS's partnership with the Pontifical Catholic University has been named the #1 healthcare brand in the country. In Colombia, our partnership with Cumeva includes hospitals, clinics, home care, and health insurance services in virtually every community in the country. Because of this focus, CHRISTUS is delivering superior performance by nearly every measurement. We're in the top quartile in patient safety measures to reduce preventable harm and further illness for our patients. We've lowered our all-cause readmission rates to be sure our patients remain out of the hospital after illness to recover and heal. Our patients report that they're more satisfied with their experiences, as our patient satisfaction scores have continued to rise over the past 2 years. And we provide more free services and charity care to our communities than many other not-for-profit providers in the U.S. With the help and support of our congregations, CHRISTUS Health has delivered substantial growth. In the last decade, we've expanded from 2 countries to 4. We've grown from 200 associate physicians to 4,000, from 29,500 associates to 45,000, from 1.8 million patient encounters each year to more than 6 million. And we've increased the ratio of poor and underserved patients cared for by our community benefit funds by 91%. Today, CHRISTUS and our associates are changing the way healthcare improves the lives of individuals in the Americas. We've been serving our communities and extending our mission for 150 years. And we're making sure we have the leadership to continue improving our care for the next 150. This is our CHRISTUS Health.
This is our CHRISTUS.
Este es nuestro Christus.
This is our 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 CHRISTUS Health, expanding innovative health and wellness solutions across the globe.